Hey guys, welcome to another one of our videos. And in this series, we're going to be talking about tips on how to be able to not lose your patient to other agencies. So that's what we're going to be talking about in this video. Now, before we get started, don't forget to subscribe to the channel and click the bell icon to be notified of any new videos being released. So guys, it's so important to be able to get more patients. It's so important to be able to keep our patients. And it's also important that we don't lose our patients to other agencies as well, right? So this is going to be one of the tips that I want to be able to share with you guys that you guys should actually take to heart to know, because losing agencies is definitely a hard thing to do, right? And so let's go ahead and get started. So make sure like your staff, they're aware where your patients are. Your nurses need to make sure they keep on checking with the patient and keep tabs where they are. If you have a patient that ends up being transferred to a hospital, make sure that you will follow up with the hospital. What you can do is you can call the hospital up, call their admissions department, and ask them. Let them know that your agency and you're taking care for this particular patient that they have at their hospital right now. What you can do to make sure that you are in the list, that they actually write the name of your agency down as the primary agency in their discharge forms or in that patient's chart, is say, hey, listen, would you like more information about the patient just in case there's something lacking? Because one thing we want to do is we want to be able to have continuing care. If they end up in the hospital, we want to make sure that the hospital gets all the history and physicals of the patients. Remember, when a patient gets discharged to your agency, you expect that hospital to give all the information from the hospital to you to be able to properly admit them so you can give them proper care and proper services. I would think that it'll be the same thing for your patients, especially for that hospital, to get as much information as possible, as much history and physicals, as much as their medication list, right? So they can give proper care for the patients. So let's say, for example, one of the physicians order your patient to be admitted to the hospital or to be brought to the ER. I always recommend home health agencies to reach out to them automatically and to let them know that you have information that you want to transfer to them so that they can take care of the patients. What I've done in the past is that my liaisons, my team, my marketing team, as well as my nurse liaisons that has worked for me, when a patient gets discharged or gets admitted actually to the hospital and discharged from my agency, I will automatically make sure that one of our representatives goes straight to the ER, go straight to the admissions department, and bring in patient information for them. Hand it to them directly, right? Why do you want to do this and not just faxing it? Here's the main reason, right? You can come in over there with the patient's information. It shows that you care. It makes you stand out. And at the same time as when you hand the information to them, you can ask that person to make sure they enter your name as the patient's current home health agency. What this does is that when the patient is being discharged, the discharge planner, the social worker, will automatically see the name of your company. It makes it easier for them to be able to have an agency that's already assigned to the patient, because they don't have to call around to all these other agencies. They know that you know the patient already, and it'll be a lot easier for them to discharge that patient and to take care of that patient's discharge information because somebody is already aware of that particular patient. So remember, this is just another tip on how not to lose a patient to another agency. If a patient of yours gets admitted to the hospital, make sure that they are getting the information about the patient from you. Everything that you send them, if you're deciding to fax something to them, better have the information of your agency. Stamp it in every single page. Make it a habit to do that. And the best thing to do is to literally drop off the paperwork yourself or by liaison. Drop it off with all your information in it with a cover letter to let them know that you care about the patient and that you would like to be called when the patient is being discharged. This is probably one of the best ways to handle this and to make sure that you are not losing any of your patients at all. You have to pay attention to that. We even actually give our patients one of these little patient cards. We have one of those ID machines that makes the professional IDs, those really hard stock IDs. But so we make them a custom ID from our company. But in that card has all the patient's demographics, their address, their name, their date of birth. We don't put their social security number in there, but we do put the Medicare number. And then what we do is we put all the list of all the medications that they're taking, all their current diagnosis as of a certain date. We put the date when the card was printed in there. And then at the very same time as we put their allergies, we put the information of what the last nursing home they stayed in, what's the last hospital they stayed at, who their primary care physician is. And of course, big bold letters in the front is we are the current agency that's taking care of them and our contact information. So that's just another way, just in case we're not able to send our liaison, guess what? All of a sudden, this patient can go, hi, here's my information. And so right there alone in that card, they're going to be impressed. I've seen admission people in hospitals when they see those things. We've gotten calls and they're telling us, wow, that's one of the most original things I've ever seen. But one thing is you're making sure that the transition of care from your agency being discharged a patient to the hospital being admission, that the patient's getting all the information. Because not all patients can remember all their medications, right? Sometimes they'll bring in their medication baggie with all their medications, and some of the meds there have been discharged, or maybe the doses have been changed, and then all of a sudden they're getting the wrong medicine at the hospital just because they just brought those thinking that that's what they're going to be taking. So we have to understand is that our goal here is to, number one, get the patient back to us. Number two, we want them to heal in the hospital and then get back to us as well. So you're doing two things. You're helping the patients, you're helping the admissions team, you're helping the hospitals. It gives them to look at you as a resource that they maybe want to work with you guys. So this is another tip. Make sure you watch the next tip that's coming up, the next video. Make sure you subscribe to the channel, click the bell icon to be notified of any new videos coming out. This is Michael, Home Health Success Academy. Understand helps you guys increase your census and your profits for your agency, and always understand that home health marketing is easy when you know what you are doing.